Earle, and we're here at Pure Plastic Surgery, and today we are going to kick it old school. What does that mean? No presentation today. Today it's all about the questions. So if you had some like yearning, burning plastic surgery questions, anything from head to toe, well, now's the time to ask. I'll be happy to answer, okay? You know that you're getting good, reliable information because it's coming from a double board certified plastic surgeon. Not only that, Ivy League educated and Duke trained, pretty much the top of the top, okay? So, but before that, I want to talk about a couple things. Number one, you guys may have noticed this little guy going on here, right?
wait.
Yeah. So I have the mustache going on for Movember, right? So what is Movember? So this is the month that we want to talk about and discuss and support men's health issues. And specifically when you're talking about Movember, they're talking about 4 specific issues that we want to bring to the forefront, okay? One of them is prostate cancer. The second one is testicular cancer. The third one is mental health issues, including depression and alcoholism. And the fourth one, actually very important, is suicide prevention, okay? I'm not sure if you guys know this, but there's about 60 men committing suicide throughout the world every single hour. That's a guy a minute, basically. A guy a minute. And so that has to stop. And so that's what Movember is all about. It's about, you know, wearing the mustachio so people ask you about it, so you can then discuss these issues to kind of bring it to the forefront, and also about supporting all these foundations that deal with those 4 things, with prostate cancer, testicular cancer, mental health issues, and suicide prevention. All right? And you want more information about this, Google Movember or go to Movember.com and you'll see what it's all about. All right? It is an issue that's very near and dear to me, as my own father had prostate cancer. He had to undergo surgery, and fortunately after that, you know, he was able to beat it. But it has happened, you know, in my own family with my own father. Okay? All right. Next thing. I said today there's going to be a very special announcement, okay? Yeah. And honestly, I can't believe we're doing this, but they kind of roped me into it. So I said, you know, like last week, I said we had our last 5 spots for 2024, for December 2024. And so there was a huge wave of people wanting to get those last 5 spots, because not only were the last spots of 2024, but they were all getting like special reduced pricing. I'm talking like, you know, 20-30% off, something that I never do. And so the spots, boom, they went like hotcakes and they're gone. And we have a lot of disappointed people out there. So we decided to open up 1 more surgery day, okay? And I'm only gonna do 3 more surgeries that day, and that's it. So 2024, 1 more surgery day's open, 3 more spots, and we're done. I'm done. I'm tired, guys. So that's it. I'm done. All right. So 3 last spots. If you want to go for it, you gotta get on it right now. And because you know, we have little time to get prepared, there are gonna be special pricing, and that's it. You're not gonna see special pricing again till I don't know when. Who knows when? I never do that. So in fact, starting in 2024, prices are going to go up. Okay, they're gonna go up in 2025. I'm sorry, starting in 2025, prices are gonna go up. So once 2024 is done, everything's gonna go up starting 2025. So get these last 3 spots. These are the ones that are gonna have special pricing, the last 3 for 2024. But even if you're thinking about surgery for next year, now is the time to like really hit the phones, because prices will go up in 2025. All right? So,
we need that in Spanish. Un resumen en español de eso.
Un resumen en español rapidito, sí, porque hemos recibido muchas llamadas de pacientes en español, y lo que quería decir es que, bueno, la semana pasada tenía los últimos 5 cupos para este año, para diciembre de 2024, y llamó tanta gente que se llenaron en un par de días. Y entonces, bueno, aquí la oficina me pidió de que por favor, abrir un día más de cirugía, que, bueno, lo hemos hecho. Pero no, son solo 3 cirugías más que voy a hacer ese día, y ya sé, pues me cansé. 2024 ya se está acabando, o sea que si quieren estos últimos 3 puestos, tienen que llamar hoy en día, porque se van a ir rapidísimo, y son los únicos puestos que tienen precios especiales. Después de eso, empezando ya en enero 2025, todos los precios van a subir como lo hacemos todos los años. ¿Ok? Alright, bueno.
I'm ready.
Yes, let's do it. Vamos a hacer las preguntas. Ready for questions. Pueden preguntar en español. You can ask in English, and I'm happy to answer.
Why can't a BBL and breast augmentations be together? Other surgeons do it.
So that's right. There are other surgeons that choose to do that, but I'm going to tell you why I, in my professional opinion, do not think it's a good idea. Okay, and there's a few reasons. Okay, number one, recovery is very, very tough. So you're going to be compromising one of your results, right? When you do a breast augmentation, you can't be on your chest, you can't be on your belly. But when you do a BBL, you shouldn't be on your buttock and your hips. You shouldn't be on your back, right? So one of those two things is going to suffer. So typically what happens is then that you choose to be on your back and you do have like a mattress with a cutout or something of that nature, which sometimes, yeah, that relieves some of the pressure on the buttock itself, but it does put pressure on the hips. And so now you're compromising your results in the hips, which is an area which is already in and of itself tougher for the fat to survive. So that's one reason. Your results are going to be not as good, right? If you really want the best long-lasting results, I would separate the procedures. Number two, whenever you add a procedure like this to a BBL, you are increasing the risk, right? Complication rates then go up. Complication rates for open wounds, for infections, and importantly for blood clots. So clots that can form in the legs, your DVTs, or clots that can form in the lungs, your pulmonary embolus. So all those risks go up when you combine those procedures. I just don't think it's worth it for elective procedures, all right? And last but not least, and this is specific to Florida, is that here in Florida, when you do something like a breast augmentation, you're then limited by the Florida Department of Health as to how much fat you can then place, which is only 1 liter or 1,000 cc's, which is typically not enough in terms to do like an appropriate liposculpture and fat transfer to the buttock and hips. So therefore, you're going to have also, again, a lesser result for your BBL than you would otherwise. So for all those reasons, I do not combine them. I recommend they be separated. I recommend you can do your BBL. In this case, if you want, you can do your BBL first, and then 3 months later, you can do your breast augmentation.
Okay. Okay, I have a scar from a lift from years ago.
Okay.
It's not a keloid. That means that I'm high risk for fibrosis with lipo?
Not necessarily. Not necessarily. I mean, there is people that keloid easily, and you said it's not a keloid, but for people that do keloid easily, then they may have a little bit of a higher risk for fibrosis because it all has to do with how they respond, right? Their inflammatory process that their body goes through when they respond to trauma. And so what happens when you do a keloid is that process is exaggerated, and so it creates this, this hypertrophic scar or this keloid. Now, for you in particular, you said you don't have a keloid, so it doesn't necessarily correlate. You may have just had a bad scar because maybe there's a lot of tension, or maybe you moved a lot initially, or many, many other reasons. And that doesn't necessarily mean that you're going to have problems with fibrosis when you do your liposculpture or BBL.
TikTok asks, where are you located?
We are in Miami. That's right. We're in Miami, Florida. But I would say we're about 85% of our patients come from out of town. So we do take patients from all over the U.S. I think we've hit pretty much almost every single state. And we do take a lot of patients that are international.
49.
So patients, 49 states. And then patients, we get a lot of patients from Canada. And the UK as well. So patients coming all the way from Europe, Canada, and even as far as Ghana in Africa and Australia.
Okay. Still on TikTok, do you recommend Thupa Lipo with Lipo 360 for more harmonious results?
Definitely, yeah. And for me, that's included. I don't charge that as say an extra spot when I'm doing Lipo 360 because I do think it's just part of your trunk. So when we talk about Lipo 360, we're talking about lipo of the trunk area. So that means like the entire abdomen, and for me, yes, the fupa too, as well as the flanks, the sides, the waist, and then pretty much the entire back. The only thing within the trunk that we would consider additional is if you have a buffalo pump all the way up here, that I consider an additional area. And then of course we can consider other additional areas that are outside the trunk, yes, such as your arms, your thighs, your chin, your axillary areas as well. All right.
Is the mustache for November?
Yes, that's right. No Shave November or Movember. So I am what they call a Mo Bro, and that's exactly right. So as we said here at the beginning of the live, it's about bringing awareness to men's health issues, particularly specifically prostate cancer, testicular cancer, mental health issues such as depression and alcoholism, and suicide prevention.
Is there such a thing as a mini tummy tuck?
There is such a thing as a mini tummy tuck, right? So when you talk about tummy tuck, you have several types, multiple types. And if you really want, I can do a whole live on just this. So if you really want this information, you can go to our YouTube channel. So go to YouTube and then search Pure Plastic Surgery. And there you're going to find all my old lives that I've been doing for many, many years now. And I can probably answer any question that you may have, but including this one specifically. But yes, a mini tummy tuck does exist, but people don't often know exactly what it means, right? So a mini tummy tuck does not mean that the incision is mini. In fact, the incision for the mini tummy tuck is almost as long as the incision for the full tummy tuck. And it does go wider than your typical C-section scar. But what makes it mini? What makes it mini is that you're only removing skin from the belly button down. So you're not removing skin up. So you're not making an incision around the belly button. The belly button stays in place, okay? But the other thing you're not doing is muscle repair. So with a mini tummy tuck, you don't do the muscle repair. So again, that's what makes it mini. It's not so much the length of the incision, but you're doing a lot less work. You're simply just removing a little bit of a little bit of excess skin from below the belly button. So not everybody really qualifies for that. Most patients qualify for your regular or full tummy tuck because they need to be removing skin not only from the lower belly area, but also from the upper belly area, as well as doing the muscle repair because they have either muscle weakness or separation from pregnancies or massive fluctuations in weight.
Can you talk a little bit more about Vaser, please?
Yeah, the Vaser. So I really, really like the Vaser. I've been using it now probably for about a year and a half, I would think. So the Vaser, and just so people see, it's Vaser with a V, okay? And because the type of energy that it uses is ultrasound energy, okay? It's ultrasound energy that it uses. And so what does that ultrasound energy do? Well, it helps release the fat. The technical term is that it helps emulsify the fat. But basically that it means it kind of knocks off the fat cells from the surrounding tissues, which means that I can remove more fat. Okay, more fat is being removed with less inflammation. Okay, and also less bleeding. And better skin retraction. So it's a great, great tool. I love the Vaser and I use it for all of my liposculpture and BBL cases because, I mean, who wouldn't want this, right? Who would say no to more fat removal with less inflammation and less bleeding and better skin retraction, right? Absolutely nobody. So it is basically already included with all my liposculpture, high definition liposculpture for sure, and BBLs.
Okay, let's stay there in the Vaser.
Yeah.
Because another question is, what's the difference between Vaser and J plasma?
So the difference is that there are actually two completely different forms of energy, okay? So the Vaser here, like I said, uses ultrasound energy. Okay, the Vaser uses ultrasound energy. And so it's basically, think of it like super high pitched sound that causes a vibration basically. And it does though also impart some actual energy and heat, which is what helps with the skin retraction. Now the J plasma or Renuvion, that uses an energy called RF, radio frequency energy. Okay, this is more like a heat-based type energy. All right, so it uses radio frequency energy. Now the J plasma or the Renuvion does help with skin retraction, you do have to be careful. If you overdo it, you can burn the skin. You can actually do that with the Vaser too if you're not careful. But you can, it's riskier with the J plasma. So you have to really be careful. Make sure you go to someone who has some good experience with it.
And we offer body type.
We offer body type. That's right. So body type is similar because the body type also uses radio frequency energy. So if you want basically two machines that are similar, then the J plasma and the body type are very similar because they both use the same type of energy, which is that RF energy, and they both are indicated for the same thing, which is for better skin retraction. But they don't do this other stuff here. And then the Vaser is different because it's a different type of energy that it uses, and I think it does also not only the skin retraction, but it does this where you can remove the fat, decrease the inflammation, and decrease the bleeding.
How long do it take for your nipples to heal if you have a tubular nipple reduction?
If you have a nipple reduction?
Yeah, for a tubular breast. Yeah.
Oh, for tubular breast. Okay,
Yes.
so that's a good question. So when you have a tubular or tuberous breast, there's a few things that are going on for those that don't know the term. This is when the breast it's basically, the base of the breast is constricted, so it's narrower than the normal breast should be, okay? And then the areola, so it's not just the nipple itself, but the areola, it's larger than it should be in comparison to the rest of the breast. And it tends to be also like very, very puffy, what we call like breast tissue herniation into the areola, okay? So there are ways to improve this significantly, but it typically does involve the use of an implant, okay? So if you want to fix a tuberous or tubular breast, you have to use a breast implant. And for these particular cases, it's best to actually use the breast implant over the muscle. All right, that is the best way to fix this. And then you got to do a few things. You got to do the augmentation with the implant. You got to release that base, and you got to expand the base of the breast. You have to release the breast also from the inside, and you then have to reduce the areola, which I think was you're referring to. So you have to do an areoloplasty, or what some people call a donut lift. Okay, and so when you do all that, well, it's going to take 6 weeks for things to like fully heal. But most patients are back to like driving and office type settings in about 1 week.
Doug, a lot of questions about the last pod, a lot of questions about pricing, what prices your BBL start, so what they can do.
Okay, let me put it this way. The best price that you are going to get for BBL or any other procedure for me is going to be these 3 spots. Okay, you're not gonna see a price like this the entire of 2025.
No.
So don't delay, and they go like hotcakes. All right, so I'm talking anywhere from like 20 to 30% off. Okay, so that's it. If you wait till these 3 spots are gone, then at the very least you're going to get my 2024 baseline price. But if you decide to keep waiting up until next year, then prices are going to go up in 2025. So I'm telling you right now, you don't want that, okay? And for those of you that have followed me for a long, long time, you know that this is true. Every year my prices go up, and that's been happening for the past 6 years that I've been doing this, okay? So you want to take advantage of all that right now.
Okay. And where they can book, because you didn't tell that.
Oh. Doesn't everybody know already?
No, there's people that doesn't know, Doug.
Oh, okay. Well, let's give her a phone number.
The out-of-town patients wants to know how to start consultation and all that.
Okay, and then. Okay, so you want to call the office directly. It's 305-230-4326. However, probably the most efficient way is to go through our website. So you go to www.pureplasticsurgery.com, okay, and you're going to find there a button that says Start Your Journey. You're gonna hit that button, and that's gonna lead you to a questionnaire where you can fill out some information. If you want to do a complete virtual consult, you can do that on the website as well, where it's gonna ask you more questions, what procedures you're interested in, and it's gonna ask you to send in some photos. And then that way, those photos can come directly to our patient care coordinators, who will then reach out to you, and I'll be able to go over all the information and make my recommendations, okay? So, una vez más en español, okay? Si quieren estos últimos puestos, que ya les digo que van a ser los mejores precios para mí en todo este año, y ya en el 2025 todo va a subir. Son los últimos 3 puestos, deberían de llamar hoy, porque se van a acabar, ok? Y pueden llamar al 305-230-4326, o también pueden llenar un formulario online, lo que le decimos una consulta virtual, y pueden ir a nuestro sitio web, que es www.pureplasticsurgery.com, www.pureplasticsurgery.com, y ahí van a ver, si necesitan ver el website en español, hay una banderita española ahí que la pueden hacer clic y sale sobre toda la información en español, ¿ok? Incluyendo el cuestionario, que lo tienen que llenar con toda su información, mandar unas fotos, y así podemos hacer una consulta virtual. Así que todas las pacientes que no viven acá cerca de nosotros, que no están en Miami, no se preocupen. El 85% de nuestros pacientes vienen de otros estados o internacionales. Así que lo pueden hacer todo online con consultas virtuales.
Y nuestro equipo les dará el hotel y el transporte y toda la información y todo lo que quieran saber.
Así es, y nuestro equipo es totalmente bilingüe. All right, everybody, our team is completely bilingual. Every single member on our team speaks English and Spanish.
Okay, Doug, do you recommend a fat transfer for breast augmentation for someone who doesn't want implants?
So, my personal feeling about this is I personally don't like that procedure, because I just don't think it's very, very powerful in a sense. Because when you do fat transfer for breast augmentation, you're very limited as to how much fat you can transfer. Typically not much more than 200, maybe 300 cc's if you're lucky. Because if you do more than that, then you're going to get into a fat necrosis and scar tissue, and it's not going to be good. And so you can only achieve a modest, very modest change. And the other thing that you cannot do with fat transfers, you can't really change or alter the shape of the breast. A lot of breasts require that as well. So I personally don't like to do that. It's really not my preferred procedure. I'd much rather use an implant. I think you're going to have a much better, much longer lasting result with that. Now, having said that, Dr. Vidal and Dr. Wigriff, who are my partners here at Pure Plastic Surgery, they definitely do some fat transfer to the breast. So we can accommodate you for that. So if you're interested in that, please go ahead and give us a call. And then, yes, we can recommend Dr. Vidal or Dr. Wigriff, and they can take care of you.
Let's stay in the breast area with this question. Can you do implants later after a single breast reduction and breast lift if you feel like your breasts are smaller than you would like?
Yeah, so definitely. You're not burning a bridge. So that happens. It happens sometimes because this is like the typical scenario. You're a little bit overweight and the breasts are way overweight. They're causing some back pain or neck pain, and so you decide to have a breast reduction and a breast lift, okay? But then, say after that, you start taking Ozempic or you start taking some other medication and you lose the weight, and so now you lose a lot of volume in the breast, okay? So now you have a lifted breast, but it's a deflated breast. And so then, so a lot of patients do come back and say now they want an implant. And so that's not unusual, and it's very, very possible, and it typically looks great afterwards.
Love you, Dr. Earle, best surgeon and team.
Yeah, thank you so much. I really appreciate that. Let everybody know. Tell all your friends.
Tengo mi cirugía programada con él, o sea, con usted.
Sí.
Sí, en TikTok también. Está esperando que supere sus expectativas. Y pone unas manitos así.
Yes. High five.
High five.
No, high 10.
High 10. Okay, let's keep there. More questions. Can you repair previous liposcar tissue? I'm so lumpy and bumpy from prior surgery.
So it is possible, but it's challenging. Okay, I'm not tell you that it's an easy surgery or that it's something that it's easy to do, because it's not. So here's the thing: if you do develop fibrosis, then and it's been over a year since the last surgery, then typically the way to try to fix it or smooth it out is with another surgery, unfortunately, right? If you have it, if you feel that within the year, sometimes you can do some non-surgical things to try to fix it, like wood therapy or cavitation or other things that potentially can be done. But certainly if it's been after a year, then you typically have to go back to the OR. And one of the tools that helps with that, once again, is the Vaser. So the Vaser is one of the tools that I use to try to break up some of that fibrous tissue so that we can then try to smooth it out, okay? But I do take these on a case-by-case basis because I really want to kind of make sure that it's something that I think that we can make better, right? Because the last thing that we want to do is take you back and try all these things and then it doesn't get any better or it gets worse, right? So I do take these on a case-by-case basis. I have to evaluate you, evaluate your questionnaire, look at your photos, and determine whether I think I can help.
Do you recommend internal bra or mesh bra? Is it safe?
So, okay, last question first. Is it safe? Yes, it is safe. Do I recommend it? Yes, for particular cases. I recommend it for secondary cases, meaning someone who had a primary breast lift or breast lift with OG and then the tissue bottomed out. So if you have bottoming out and you're going to go back to try to fix it, then yes, I do recommend using that bra. So I use it mostly for reconstruction or secondary type cases. What I don't use it for is a primary case, meaning this is the first time you're ever having a breast procedure. I think that's where when some surgeons kind of take it a little bit too far, I think it's overkill to go ahead and like put in the mesh bra from the very beginning. I mean, these meshes are very, very expensive, and for most primary cases, I don't think they're necessary.
Is Vaser included with your BBLs?
Mm-hmm. That's exactly right. So for all of my BBLs, Vaser is included. So that is part of the package. So we include a whole bunch of things, but definitely Vaser is one of them.
Okay. Okay, no question. Just huge thanks for helping me back to feeling like my pre-children body.
Ah, yes. Thank you so much. So we appreciate that feedback because at the end of the day, that's what it's all about, right? We want to improve quality of life. We want to give back that self-confidence. And we hear like stories like this all the time. So thank you for sharing. But it's incredible because sometimes it's just like that kickstart that you need to really get back into things. And like I always say, the best combination is all three, right? I think surgery plus nutrition plus exercise can bring out fantastic results that last for years and years.
Okay, can you get a BBL if you are 50 kilograms and are very petite and they want a very full and very thick big look?
It seems like one thing.
100 pounds, right?
Yeah. So if your BMI is low, which is sounds, I didn't make the calculation, but it sounds like in this case it is. Say your BMI is, less than 21. You're not going to have a whole bunch of fat to then give you like that very voluptuous type of look, right? So typically my low BMI cutoff for BBL is 21. So if you're below that, I usually ask my patients to gain weight. So my low cutoff is 21, my high cutoff is 30. And so that's where you want to be. You kind of want to be in between those two. I would say kind of right in the middle is where you get the best results, somewhere around a BMI of 25 or so.
Okay. Have you had patients struggle with depression because of their body and then get a BBL and their depression was cured?
We had that for sure because, body image affects the way that you kind of think about yourself in general, mentally, right? And so I think there's a lot of, I always find it, I think, I don't know, tough or annoying, where, you know, someone is not happy with their body image, and then someone out there is just being like, well, why don't you just diet and go to the gym, and, you know, and they like yell at you, and it's like, how is that helping, right? You know, a lot of times you can lose weight and go to the gym, and you still, that's not going to change the shape, the, you know, the overall shape of your body. There may be areas of fat that are, you know, just resistant to the gym, because when you go to the gym, you can't target specific areas like you can surgically. Okay, so I think that, you know, the patients that basically at least have the courage and the empowerment to take control of their bodies and know that there's a solution out there, such as surgery, that can really change their bodies. That's the first step to a huge kind of life-changing journey that they're going to go on. And so they'll have surgery, and then that's like a huge boost, but it doesn't stop there, because self-esteem, self-confidence starts to shoot up, and so they want to, it's like a fulfilling prophecy, like things get better and better and better, because after that, then now they want to really take care of their body. Now they're getting that good nutrition program. Now they're going to the gym. Now maybe they're eating less junk food, etc., etc. And so we've seen tremendous transformations here at Pure. Just complete 180s, where people are just ecstatic after their surgeries.
Doc, can I say I'm one of those? Now that I'm thinking, yes.
Right.
Yeah, I feel better after my surgery, of course.
Yes.
Hago ejercicios de fuerza, gym,
Okay.
pero me voy a hacer una lipo 360 más BBL. ¿Tengo que dejar de hacer ejercicio antes?
Antes no, pero después sí. Ok, so antes del procedimiento puedes seguir con tu rutina, pero después del procedimiento vas a tener que parar un mínimo de 6 semanas. So 6 semanas sin ir al gimnasio, solo vas a poder caminar, pero no puedes levantar cosas pesadas, ok. Y bueno, después de las 6 semanas ya puedes empezar a volver al gimnasio, hacer pesas, hacer squats. Los squats ayudan mucho con la forma de los glúteos a largo plazo.
Doc, nos vamos.
That's it? No.
That's it.
Yeah,
Yes.
media hora?
More? 33 minutes.
33 minutes. All right. Awesome.
Yeah.
All right, guys. Well, you know, sometimes I just really enjoy kicking it old school, right? Just answering as many questions as I can, because I know that things always come up. But you know, next week, I don't think there's going to be a Hump Day Live, because I'm on vacation for Thanksgiving. So I'll send shout outs from Puerto Rico. But we'll see you guys the week after that. Okay, so make sure to tune in on Hump Day with Dr. Alex Earle. We'll see you then. Take care, everybody. Ciao.